And this is my informative speech on skin cancer, and this is my audience.
Hey.
Where's
Hello.
the third one? Right there. Have you ever waited for a phone call from a friend or significant other? It can feel like it takes forever to receive it. Now imagine waiting for a phone call on a test for skin cancer. Skin cancer can be very threatening, and today I'm going to inform you on the 3 kinds of skin cancer, the causes, treatments, and tips on detecting it. According to Elaine Mariup and Katja Hohn in their book Human Anatomy and Physiology, 1 in 5 Americans will develop skin cancer in their lifetime. Knowing how to prevent it will help you not become a statistic. Now that I've given you an overview on what I will be speaking about today, I'm going to go more into depth about it. Some people will get skin cancer from the ultraviolet rays, which are also known as UV rays, that come from the sun. And some will be unlucky enough to get it through genetics. The UV rays will react with the cells and cause mutations. Cancers from UV rays are mostly avoidable. Tanning beds should be avoided altogether, because it's just a person laying in a bed of UV rays, which clearly can cause skin cancers. And when you're going outside for long periods of time, always try to use a sunscreen. And according to prevention on the website of Center for Disease Control and Prevention, use a sunscreen of SPF 15 or higher. One thing a person should always remember is that there's no such thing as a good tan. Sometimes somebody can be unlucky enough to get skin cancer through genetics. When this happens, there's a mutation on the genes on chromosome 9. This will cause unregulated skin growth. If you're unlucky enough to get it genetically, all you can learn to do is how to catch it. Knowing what to look for can help you really catch it early, so you know you can survive if you get one of the worst kinds. Some people are unlucky enough to end up with skin cancer, and there's nothing they could have done to prevent it. Knowing the 3 kinds of skin cancer can help a person detect it. Basal cell is the first kind. It is the most common, and according to Human Anatomy and Physiology, it is responsible for 80% of skin cancer cases. And according to National Cancer Institute website on types of cancer, it is slow growing and is usually found in spots that are commonly exposed to the sun, such as the face. It will appear as a shiny dome, and sometimes it will dimple inside of it. Squamous is the second most common type of skin cancer, and it is commonly found on the scalp, lips, ears, and hands. It is a raised, red, and scaly surface. Melanoma is the most dangerous kind of skin cancer. It accounts for 2 to 3% of cases, grows very fast, and is extremely prone to spreading. According to the genetics of skin cancer from the Stanford Medicine website, 1 in 60 people will develop melanoma cancer in their lifetime. Now what happens when you detected it and you know you have skin cancer? You get it treated. Each skin cancer has different means of treatments. Basal cell can be cut out and is fully cured in 99% of cases. Squamous, if it's caught early enough, can also be cut out, or if the spot will go through radiation therapy. A complete cure is also common in this one. Melanoma is very resistant to chemotherapy and spreads very quickly. If you want to survive this cancer, it must be caught early. Removing it, it's removed through large surgical incisions and immunotherapy. No one wants to go through the scares of skin cancer, so knowing your body can really help you detect it early. Keeping track of your moles on your body is a big thing, because if you know the moles on your body, you can always tell whether they're growing rapidly or not. If they're growing rapidly, that is probably not a good thing. And being able to identify melanoma is also a very big deal. When identifying melanoma, follow the ABCD rule. According to the ABCD rules on the website Melanoma Foundation, A is for asymmetry. Always make sure your moles are symmetrical. The sides should not be really different. And for borders, B is for border. Make sure there aren't notches and grooves in the borders. C is for color. Make sure your mole is not a big splotch of reds, blues, blacks, and tans. That is not normal whatsoever. And D is for diameter. The diameter of a mole should never be bigger than a pencil's eraser. Hopefully being more informed on skin cancers, what to look for, and how to prevent it can help you catch a case for yourself or for a loved one. And this is my audience again. Where is everyone?